Welcome to Medical Careers You Didn't Know About, the series where we uncover the hidden heroes of healthcare. I'm Infinite, and today we're diving into one of the most misunderstood yet powerful roles in the healthcare revenue cycle, and that's the Chargemaster Specialist. This is a person who keeps the hospital's financial heartbeat in rhythm, ensuring every service, test, and supply is coded, compliant, and reimbursed the right way. If you've ever wondered who makes sure hospitals actually get paid for the care they provide, this is the one. Before we get started, don't forget to like, share, and subscribe this video with someone who's ready to step into a meaningful healthcare career. And if you're serious about learning the language of the medical field, grab my free medical terminology guide for this specific career path. And for those who are ready to go deeper, my extensive Chargemaster Career PDF is available at an affordable cost, packed with step-by-step insight, tools, and resources to help you thrive in this role. Now, let's jump in and decode what a Chargemaster Specialist really does and why they're one of the most valuable players in healthcare finance. Let's get started.
Step into the world of infinite intelligence, where knowledge meets entertainment and brilliance. You'll find the answers to life's greatest questions. With every video we spark new obsessions. Infinite intelligence, we're here to elevate. Unlock your mind and let the wisdom resonate. We dive into the depths of the universe unknown. Infinite intelligence and knowledge is our own.
This Chargemaster Specialist Career Roadmap is your comprehensive guide to mastering one of healthcare's most critical revenue cycle roles, where financial accuracy meets clinical care. Now, what is a Chargemaster Specialist? A Chargemaster Specialist, also known as the CDM Analyst or Chargemaster Analyst, manages the financial backbone of every hospital. This comprehensive database contains every billable service, procedure, supply, and medication, linking them to proper billing codes and charges. This role ensures revenue integrity, compliance, and reimbursement accuracy by maintaining precise charge capture systems. You'll bridge the gap between clinical operations, coding departments, and billing teams, ensuring every service delivered translates into accurate revenue. Now, why does this role matter? First and foremost, we have revenue protection. It prevents millions in lost revenue through accurate charge capture and compliance monitoring. Next, we have Compliance Guardian, ensuring billing practices align with CMS regulations, payer contracts, and federal guidelines. And lastly, we have Cross-Functional Bridge, connect coding, billing, clinical operations, and finance into one seamless revenue cycle. The Chargemaster is the hospital's financial operating system. Every claim, every reimbursement, every revenue dollar flows through codes and mapping you maintain. Your precision directly impacts cash flow, compliance standing, and organizational financial health. So, in other words, the Chargemaster is the glue that keeps all this functioning, maintaining a functioning financial operating system. So, what is the day in the life of your core responsibilities as a Chargemaster Specialist? Now, first, you will be updating billing codes. You're going to be reviewing and implement quarterly CPT and HCPCS codes, ensuring all services reflect current coding standards. As we know, codes are updated every single year. So you want to make sure, which I've mentioned this in past videos, that these codes are no longer, are not expired. They can no longer be used, etc., etc. All right. Now we're going to audit charge capture. Analyze charge data to identify discrepancies, missing charges, or coding errors before claims submission. Next, we have map revenue codes. You're going to validate that CPT codes align correctly with UB04 revenue codes for accurate claim processing. All right, next we have resolve billing edits, which would be investigating and fix edit errors, work with billing and coding teams to prevent future denials. And lastly, we have collaborate across teams, partner with HIM, compliance, finance, and clinical departments to maintain charge integrity. So, like at my job, if we have missing charges or something isn't correct regarding the charges, or those codes aren't supposed to be used, we forward them over to the Chargemaster. A lot of times they'll go ahead and delete it out the system and either update it or it'll just be deleted. And then at that point, we can demand a corrected claim and do what we need to do to go ahead and get that claim out. All right. So what is the real world impact? We have a case study. Revenue recovery through precision. A chargemaster identifies an incorrect CPT to revenue code pairing in the emergency department that has caused reoccurring claim denials for level 4 visits. After collaborating with coding and finance teams to correct the mapping and resubmit affected claims, the hospital recovers $50,000 in previously denied reimbursement and prevent future losses. Okay, so just like I just told you, this is a perfect case study of what can happen when you have incorrect CPT codes billed on the claim. It's costly. All right, and it's definitely a ripple effect. Your work doesn't just fix individual errors; it creates systematic improvement. One correct code mapping can prevent thousands of future denials. One audit finding can trigger policy changes that protect revenue across entire service lines. Okay? So we have a reflection question. Why is accuracy in charge capture the most powerful form of revenue protection? The answer is because prevention is exponentially more valuable than correction. And I have mentioned that in several videos. Every dollar protected through accurate initial billing saves the cost and complexity of appeals, write-offs, and potential rework. Okay? I deal with rework all the time. All right, next we have essential skills and competencies. We have technical mastery. So you will definitely need to be familiar with CPT, HCPCS, and ICD code systems. We also have revenue code structures and UB04 claim forms. Next, we have billing compliance rules and payer policies. And lastly, we have claim edit resolution and charge validation. So for our analytical thinking, we have data auditing and trend identification, which is huge. You should definitely be able to identify trends, but you won't be able to identify them without auditing the data. All right, root cause analysis for denials, pattern recognition in charge capture errors, and financial impact assessment. Okay, that's under your analytical thinking. All right, your regulatory knowledge. You need to have knowledge with CMS quarterly codes, updates and guidelines, commercial payer contract requirements, OIG compliance program standards, and the Medicare coverage determination. And lastly, we have professional skills. You need to be able to have clear communication with clinical and financial teams, critical thinking and problem solving skills, meticulous attention to detail, and project management for system updates. Our key takeaway is your analytical and regulatory expertise makes you the essential bridge between compliance requirements and cash flow realities. All right. So, with that being said, you need to have, we're going to go over the technology and tools that you will master. Now, these aren't all the core systems, these aren't the only core systems, but these are some systems that a lot of hospitals do use uh, for their operating systems. Now, we have the EHR platforms such as Epic, Cerner, Meditech, Sorian for accessing charge data and clinical documentation. All right. Next, we have the CDM software such as Craneware, which I've mentioned in several videos, Enthrive, Tresus, Chargemaster. I know I mispronounced that. Specializing tools for maintaining and auditing the Chargemaster data. Next, we have data analysis, such as Microsoft Excel, SQL inquiries, and business intelligence dashboards. Lastly, we have payer portals such as Availity, Change Healthcare for researching payer policies and coverage rules. Okay, so for our pro tip here at the bottom, we have build your knowledge before landing the role. Practice Excel data, validation techniques, explore free CDM software tutorials online, and familiarize yourself with the CMS Gov code lookup tools. Okay. Now, all this sounds fine and dandy. Now, you're probably wondering, okay, where do Chargemaster Specialists work? I have down that a lot of charge masters works in hospital systems, acute acute care hospitals, academic medical centers, and children hospitals with complex service lines and high charge volume. Next, we have outpatient facilities such as ambulatory surgery centers, imaging centers, and specialty clinics requiring precise charge capture. Next, we have RCM vendors, revenue cycle management companies providing CDM services to multiple healthcare organizations. Next, we have consulting firms such as healthcare advisory companies conducting charge audits, compliance reviews, and system implementations. All right, we're going to move on to the government programs such as VA hospitals, state health departments, and federal health government agencies managing large-scale billing operations. They do have remote opportunities. Many positions offer hybrid or fully remote flexibility, especially in consulting and vendor organizations. Please note that this role frequently involves functional project work, including EHR system upgrades, revenue integrity initiatives, and compliant audits. Keep your work dynamic and strategically important. Now, what is the education and training pathway? Your educational foundation. Recommended degrees, such well, first and foremost, you need your high school diploma, but I also have down that you need an associate's or bachelor's in health information management, health care administration, business administration, or finance. Many successful specialists also come from nursing, coding, or clinical backgrounds. All right. For professional certifications, we have high volume credentials such as the CPC, which is a certified professional coder, a CCS, which is a certified coding specialist, a CRCR, which is a certified revenue cycle representative, a CHAM, which is a certified healthcare access manager, and a CFMA, which is a certifications at financial expertise. All right, and lastly, you should possibly have specialized training, Chargemaster coordinators, certification programs, compliant workshops, revenue integrity boot camps, and advanced Excel or data analysis course can also help you in your educational training pathway. Okay, so action step. One thing that you can do is join professional organizations like such as the AAPC. This is not a sponsorship, which is known for the American Academy of Professional Coders, or the HFMA, the Healthcare Financial Management Association, to access webinars, networking groups, and continuing education opportunities. Many offer student memberships at a reduced rate. Okay? Now, what does your growth trajectory look like? Okay? So, your entry point in being a charge master, which is your entry point, is maintaining codes, conducting audits, and supporting billing accuracy. Next, moving forward, you can be a revenue integrity analyst, which is a broader scope, analyzing revenue trends, leading audits, implementing process improvements. Excuse me. Next, we have the CDM manager, which is a leadership role where you will be overseeing teams, managing system implementations, and strategic planning. If you want to move further up in the scale, you can become the director of revenue cycle, which is an executive position, driving organizational revenue strategy, compliance oversight, and operational leadership. And lastly, you can become a consultant, a compliance officer, which is a specialized expertise advising multiple organizations, conducting high level audits, and giving regulatory guidance. Okay? So, for your motivational insight, every line item in the Charge Master tells a story. Those who understand it can investigate the entire financial DNA of healthcare. Your technical expertise becomes strategic intelligence that opens doors across revenue cycle. So, with all that being said, you're probably wondering, okay, what is the compensation and the career outlook looking like? Excuse me. We the salary expectations that we have on a entry level starts at 60K. Starting salary for professionals with basic certifications with 0 to 2 years experience. Okay. Next, we have 75K, which is the average compensation with 3 to 5 years of experience and specialized certifications. All right. And lastly, we have a senior level, which is 90K. Experienced specialized, experienced specialists in large hospital systems, consulting firms, or management roles. All right. Now, your path forward. Your access point, which would be clicking the link in the description below for your terminology. You can start there. It is free. You want to evaluate your current education, experience, and interests. Identify which skills you already possess and which you will need to develop. All right, then you want to build your foundation. Pursue relevant education or certifications. Start with CPC or CRCR if you're new to healthcare revenue cycle. Leverage free resources from CMS and professional associations. Next, you want to gain practical experience. Seek entry-level positions in medical billing, coding, or revenue cycle departments. Volunteer for CDM related projects in your current role. Shadow experience Chargemaster Specialist. All right. Next, after that, you want to develop specialized expertise. Master specific CDM software platforms, specialize in complex service lines, build reputation as the go-to expert for challenging coding or compliance questions. And lastly, we have networking and advance. Join professional organizations, attend conferences, and build relationships with revenue cycle leaders. Position yourself for management or consulting opportunities as they arrive. So just know that precision does pay. Behind every accurate hospital bill stands a charge master ensuring the balance between compliance and care. And mastering this role, you're not just maintaining codes, you're protecting the financial heartbeat of healthcare. The charge master is where clinical expertise meets financial reality. It's where complex medical services translate into language of reimbursement, and you, the specialist who masters this intersection, become indispensable. Every code you validate, every audit you conduct, every error you prevent creates ripples of positive impact. You protect your organization's revenue integrity. You ensure patients are billed correctly, and you help providers receive fair compensation for the care they deliver. Stay curious. The healthcare landscape evolves constantly. New procedures, new technologies, new regulations. Your commitment to continuous learning keeps you relevant and valuable. Stay compliant. Your expertise protects the organization from costly penalties and audit findings. Your precision prevents the downstream chaos of denials and rework. And lastly, you want to stay confident. Your you possess a rare combination of technical mastery and analytical thinking that healthcare organizations desperately need. And that wraps up today's medical careers.